Welcome back to another insightful episode of Healing Insights brought to you by Rising Phoenix Naturopathy. I'm your host, Dr. Tara Coppola, and today we're diving into the deep, fascinating topic that can shape and understand our health and healing, vitalism and mechanism. So, before we dive into today's episode, please note, the information presented here is for educational purposes only. It's not intended to diagnose, treat, or cure any disease. The content is shared in a general nature and should not be considered medical advice. Always consult a licensed healthcare professional for personalized guidance regarding your health and any medical conditions you may have. So, let's get started. Have you ever considered how your beliefs about your health impact your approach to wellness? Today, we're going to compare and contrast two distinct philosophies of health. Vitalism, with its focus on the vital force within us, and mechanism, which treats the body more like a machine. By the end of the episode, you'll have a clearer understanding of how these perspectives influence both naturopathic medicine and conventional healthcare. You may even start to rethink how you view your own health journey. This is going to be a full episode, so grab your coffee, grab your tea, get cozy, and let's go. Let's start by defining vitalism. Vitalism is the understanding that living organisms possess a vital force or an energy that distinguishes them from inanimate objects. This vital force is believed to drive the body's natural healing process. Vitalism has its roots in ancient healing traditions, often intertwined with spiritual practices. In Chinese medicine, it is referred to as qi, while in Ayurveda, it's known as prana. You will find that many cultures have acknowledged a life force that sustains health and wellness. Vitalism emphasizes the interconnectedness of mind, body, and spirit. It supports the idea that health is not solely the absence of disease. It is a state of balance that must be nurtured. In this philosophy, treatments aim to enhance this vital force, supporting the body's innate ability to heal, rather than merely focusing on symptoms. But let's not forget the psychological and emotional dimensions. How we think, feel, and connect spiritually play a significant role over our health. Conditions like chronic stress, unresolved emotional trauma, and spiritual disconnection can manifest physically, leading to more serious health issues. Research has shown that practices such as mindfulness, meditation, and energy healing can positively impact our mental and emotional health, creating the space for healing to occur. Now, let's dive a little deeper into mechanism. Mechanism is rooted in a more reductionistic approach to understanding the body. In this view, the body is often likened to a machine, where health and disease can be understood through biological and chemical processes. The mechanistic approach emerged during the Enlightenment period, emphasizing reason and scientific inquiry. This led to significant advancements in medical science, including diagnostic tools and treatments. Mechanism treats the body by isolating symptoms or parts to diagnose problems. It often involves addressing specific symptoms through pharmaceuticals or surgical interventions. In mechanism, the body is thought of the sum of its parts, not that its parts are intertwined and working together. While this approach can have strengths, it often overlooks the broader context of health, neglecting the emotional and spiritual dimensions that can affect well-being. So let's break down some of the key differences between vitalism and mechanism. In the view of health, Vitalism sees health as a dynamic interplay, holistic balance between the physical, emotional, and spiritual components. In Vitalism, health is more than just the absence of disease. It is the balance of all these systems intertwining. In Mechanism, health often hinges on treating symptoms and getting symptoms to disappear. Treatment approaches vary also. Vitalism focuses more on enhancing the vital force through natural remedies, lifestyle changes, and spirituality. Mechanism emphasizes pharmaceutical interventions and specific therapies aimed at alleviating symptoms. Patient engagement also varies with these two aspects. In Vitalism, patients are encouraged to take a more dynamic approach to their health through education and empowerment. Practitioners want patients to be active participants in their health journey. In Mechanism, participants may take more of a passive role, often just following prescriptions and treatments without engaging overall in their health. In the general healthcare context, there's also a difference between Vitalism and Mechanism. Vitalism is integrated with natural healing processes, herbal medicines, acupuncture, and mind-body therapies. Mechanism is predominantly associated with Western medicine and more technological interventions. However, botanical medicines and other natural approaches can be used mechanistically. Anytime we're taking something to reduce a symptom, we're acting mechanistically in the body. Both perspectives have valuable applications. However, understanding their differences helps us to choose a more suitable approach for our own individual health needs. Now, in understanding Vitalism versus Mechanism, I want to take a little caveat and talk about functional medicine. It's important to clarify the relationship with functional medicine here. I see a lot of patients coming into my office thinking I'm a functional medicine practitioner because I'm a naturopathic practitioner. This is not the case. Some naturopathic practitioners practice functional medicine. Functional medicine is one aspect of naturopathic medicine. It's not the whole thing. So let's dive into this a little bit. Functional medicine emerged in the late 20th century in efforts to address more of the underlying causes. Dr. Jeffrey Bland, PhD, who is an organic chemist, not a physician, not a medical doctor. He is often referred to as the father of functional medicine. He developed this approach after his observations of needs for more in-depth, integrative, personalized care in our medical industry. I'm sure you all can relate. Functional medicine is grounded in the understanding that each person is a unique individual. Does it sound similar yet? It's influenced by a myriad of factors, including genetics, environment, lifestyle, and nutrition. Again, a lot of alignments with naturopathic medicine. Functional medicine promotes a systems-oriented approach that is viewing the body as an interconnected whole rather than a collection of isolated symptoms. So, kind of taking a lot of aspects of naturopathic medicine and creating a sort of subset of called functional medicine. In functional medicine, just like naturopathic medicine, patient histories are prioritized, getting details. Functional medicine uses a lot of diagnostic tools and very in-depth understanding of the biochemistry of disease, seeking to identify imbalances within the system. Sounds great, right? Who doesn't want to determine what imbalances in their system are going on to get help? Practitioners of functional medicine often integrate dietary changes, lifestyle modifications, and nutritional supplements to restore and promote wellness. Now, practitioners of functional medicine do not have to be doctors. They do not have to be medical doctors. They do not have to be naturopathic doctors. They do not have to be doctors of osteopathy. Many different forms of healthcare practitioners can obtain a functional medicine certificate. Okay? That's going to jump off on that caveat a little bit. So, although functional medicine has gained in popularity, there's a little bit of criticism. One, their practitioners don't have to be medical doctors, naturopathic doctors, doctors of osteopathy, first and foremost. Then, they have a heavy reliance on testing and determining the biochemical interplays, which is great. However, it's kind of stepping away from that holistic, integrated approach of mind, body, and spirit. So, while functional medicine identifies and addresses the biological underpinnings of disease, it doesn't necessarily get to the root cause of illness, because the root cause of illness isn't always physical. So, vitalism, on the other hand, it is a holistic approach, recognizing that health extends beyond the physical aspect, integrating the components of the mind, body, and spirit together to help the patient heal holistically. This distinction is vital when you're looking for a comprehensive approach to know what the difference is between vitalism, naturopathy, functional medicine, and mechanism. Okay, let's dive a little bit deeper into how vitalism is applied in naturopathic medicine. Vitalists utilize holistic assessments. We're going to take the time to understand the patient's complete health history. We're going to assess not just the physical symptoms, not just the biochemical pathways, but also the integration of emotional and spiritual health. Then, vitalists will utilize natural remedies, not necessarily only in this symptom for that herb. That can be used depending on where its place is in the therapeutic order for that patient. However, the primary function of the use of natural remedies in vitalism is to help facilitate the body's innate ability to heal. That is the most important thing. Sometimes we do need to act a little mechanistically and come in with some herb to stop a symptom. That's not the base of how we treat our patients. Then, in vitalism, there is immense priority put on the patient-centered care. We empower patients to make informed choices about their health. My goal is to help my patients become autonomous in their healthcare, to teach them so much that they don't need me. I want my patients to be empowered and have the ability to help their body heal itself. Education about nutrition, self-care practices, stress management, and the connection between emotions and thoughts is paramount to this process. Also, vitalism emphasizes prevention through lifestyle choices that enhance the vitality rather than waiting for diseases to develop. Through these methods, vitalism aims to cultivate a healing environment that nurtures the body's natural ability to heal itself. In the practice of vitalism, mental, emotional, and spiritual modalities play a critical role in the patient's healing journey. Vitalistic practitioners recognize that health is not merely a physical state, as I mentioned earlier. It encompasses the whole individual. Techniques like mindfulness, cognitive behavioral therapy, guided imaging can help a patient address negative thought patterns, reduce anxiety, and promote emotional resilience. Does this by fostering a positive mental state. Patients can enhance their overall sense of well-being. Vitalistic practitioners will refer out if patients need to get specific forms of therapy to help their healing. This is absolutely a part of the process. In emotional processing, vitalistic approaches often integrate methods such as art therapy, journaling, support groups, which can allow patients to explore and process their emotions in a safe and healthy environment. The emotional release can be pivotal to the healing of chronic conditions that may exacerbate by stress or unresolved trauma. Again, this is another area in which patients may actually be referred to a counseling practitioner who has experience in this field to help the patients heal if the vitalistic practitioner is not have that knowledge. The spiritual connection. Engaging in the practices like meditation, energy healing, spiritual counseling help to nurture the spirit. This connection fosters a sense of purpose, belonging, and inner peace within the patient. It is essential for the components of overall health. Vitalistic practitioners often emphasize setting intentions, fostering gratitude, and creating rituals that reinforce a patient's spiritual well-being, contributing to a more balanced and harmonious life. Again, another area where referrals may be made if necessary. By incorporating these modalities, Vitalism offers a comprehensive framework that empowers patients to heal not only their bodies, but also their minds and their spirits, paving the way for lasting health and vitality. So, now let's take a look at mechanism in practice. So, mechanism utilizes diagnostic tools as an approach to determine what's occurring within the body. They use various technologies as blood tests and imaging to identify and address health issues. And it's not that a vitalistic practitioner is not going to use diagnostic tools. Of course we are. We just may use them a little bit differently or understand them a little bit differently. Then, in the mechanistic approach, they utilize what they call evidence-based treatments. So, mechanistic medicine often relies on pharmaceuticals and surgery, demonstrating an effectiveness through scientific studies and clinical trial. However, it is very, very critical to discuss the biases that can exist in this realm. So, there are a lot of biases within the research industry. Dr. Rita Redberg, editor of the JAMA Internal Medicine, which is a massive medical research publication, has been raising concerns regarding the influence of pharmaceutical companies on research outcomes. What does this mean? This means that pharmaceutical companies are having an impact on what is either getting researched or what is getting published in the research. Dr. Redberg has highlighted that studies often favor positive results based on funding sources. Likewise, Dr. Richard Horton, who is the editor-in-chief of The Lancet, another big medical publication, has pointed out that many published trials suffer from bias, noting that the very structure of clinical research can actually manipulate results. These critiques underscore the need for more balanced, transparent research. A reminder that while evidence-based practices are important, we must also consider the context in which the evidence is gathered. Now, as we explore the differences in the philosophies between vitalism and mechanism, it is essential to consider who may benefit most from each approach. Not every approach is going to be great for everybody. So, for vitalism, the ideal patient for a vitalistic approach is someone who values holistic care. They can be experiencing chronic conditions that might not have responded well to conventional treatments. These are individuals seeking answers beyond symptom relief. Often, these patients prioritize empowerment and involvement. They want to be active participants in their healing journey. They're open to making lifestyle changes that address not just their physical symptoms, but also their emotional and spiritual well-being. These patients prioritize natural therapies. They may explore more natural remedies, such as herbal medicine, acupuncture, mind-body techniques. appreciating the connection between the mind and the body and the healing process. These patients are also looking for long-term wellness. They view health as a continuous journey rather than a destination, aiming to cultivate balance and vitality through a more preventative and integrative approach. Now, the ideal patient for mechanism would be somebody who is possibly facing a more acute health issue that requires immediate intervention, such as if somebody was having a heart attack. Absolutely go for the mechanistic approach. There are certain situations in which emergency intervention is absolutely critical and needed. The best patients for mechanism desire rapid relief. They often seek quick solutions to their symptoms, especially if they're in pain or experiencing significant discomfort. The ideal patient for mechanism often has a preference for conventional treatments. These patients feel comfortable with pharmaceuticals and technological interventions, relying on evidence-based protocols guided by healthcare professionals. These patients want to focus on specific pathologies. They may be more focused on isolated health issues, seeking clarity on the biological underpinnings of their conditions, and may feel more reassured by the structure of the mechanistic approach. Understanding who best aligns for which approach can help patients make an informed choice when looking for a healthcare practitioner. Ultimately, we all have a unique health journey, and sometimes the best care can involve a blend of both worlds. So then, how can we find a balance between these two approaches in our health journey? In integrative medicine, there's a combination of vitalistic and mechanistic approaches, where we can create a comprehensive care model that respects the unique individuals of the patient. Also, through lifestyle choices, we can integrate natural therapies into conventional therapies to empower the patient to take control of their health. You can adopt nutritional practices, stress management techniques, and use natural remedies alongside the pharmaceuticals. Then, with an open communication between practitioners, vitalistic and mechanistic practitioners can work together for their patient's best interest. Engaging in the dialogue with healthcare practitioners enables a more personalized approach to healthcare. Also, having a holistic awareness fosters an understanding of how mental and emotional and spiritual aspects contribute to your health and overall well-being. Finding the balance between vitalism and mechanism allows you to navigate your health care journey with informed choices while embracing both perspectives. So, that was a lot. I thank you for joining me in today's exploration of vitalism versus mechanism. I hope this conversation inspired you to reflect on your own beliefs about health and healing and encouraged you to take an active role in your well-being. If you found value in this episode, please consider sharing it with friends or family or giving us a rating on your favorite podcast platform. Don't forget to tune in next time for more insights and strategies to empower your health journey. For more resources and information, visit the website at www.risingphoenixnaturopathy.com. I also offer a 20-minute discovery call for those interested in exploring how you can incorporate these philosophies into your health journey. You can find more details on my website. Until next time, embrace the wisdom of your body, honor your health journey, and remember, true healing encompasses body, mind, and spirit. Stay well, everyone.